Welcome to H&HN Daily. I'm Susanna Hopsollen, Senior Editor for Hospitals and Health Networks magazine. Today, healthcare delivery systems are focusing on providing the right care at the right time. The next step in transforming healthcare is to redirect resources to address the drivers of population health. Holy Family Memorial has embarked on this journey by redesigning care and reshaping its organizational culture around an exceptional patient experience. I'm joined now by Mark Herzog, President and CEO, and Amy Stockhausen, Associate Medical Director at Holy Family Memorial in Manitowoc, Wisconsin, to discuss transforming care delivery for population health. Welcome, Mark and Amy.
Thank you. Good day.
In the shift from volume-based to value-based care, how did the culture of your organization need to change, Mark?
Well, our culture is one that is, we measured it in 2009, was typical for any healthcare organization, large or rural, or a school or a church. It was conventional, dependency-based, and relationship-oriented. And when we look towards the definition of population health, which we've come to understand much more deeply than we did when we initiated this process, we realized that the change process was extraordinary in terms of how we had to reorient our resources and the attitudes of our providers to be not just themselves and that particular patient or the person they're serving at the moment, and be translational to all other parts of that patient's experience and their life in the community. So, very significant cultural change process.
What about the physician leadership? How did that need to change?
Well, physicians are traditionally very independent thinkers. They think of themselves as really working only in their little realm. We needed the physicians to understand that they are leaders, every single one of them. Even those who don't have a title after their name, even the one who's not the CMO or the clinic director of something, every physician is looked at as a leader by the employees and the staff that they work with and by their patients. Whether it's as simple as they direct a care team, or they work on a supply chain management committee, or they create a patient care pathway, or they run a clinic in one of our nursing homes, they're all leaders. And as we started getting our physicians thinking of themselves as leaders, their behavior started to change and they started acting more like leaders, which helps to move the culture shifting along much more quickly.
Your organization, Mark, is very strong in terms of quality of care. You did all the groundwork in terms of getting your costs down. You've really actually gotten money back from some of the payers because you are excellent at providing value at this point in time. Now you're going and you're going to tackle even more. What really is it going to take to be innovative, and how are you bringing the staff and the organization into this innovation space?
In our organization, we identified the fact that we would not ultimately be successful unless all of our stakeholders were meaningfully engaged in the process. Words that Amy just used. And for us, we've used lean processes to engage employees and physicians at a very grassroots level. And essentially that's getting their ownership in the change process and their buy-in to making something meaningful happen, which in this case is eradication of waste and improving value to customers. We have an innovation process that engages leadership in our board, which actually takes our services and questions why we do them, whether we should still be doing them. If we should still be doing them, should we still be doing them ourselves or through partnerships with others? We call it SPUR, and that's been extremely helpful in essentially redesigning about a fifth of our organization in terms of how we deliver the service. But the fact that we do that brings folks along on the engagement that change is good. And if we intentionally do this, if we proactively disrupt our organization where we're controlling the game, and we're doing it for the right reasons pursuant to our mission, our values, the organization is immensely more strong in the long term.
When you looked at the health of your population in your community, what did you find?
Well, it was an eye opener with us. We became aware of a University of Wisconsin Population Health Institute study, which grades or evaluates the health status of every county in the United States. And I became aware of it about 3 years or so ago, and started looking into this information. We were a little bit disappointed to find, although maybe not that surprised, that there are 72 counties in Wisconsin. We ranked 41st in overall health of the population. Now we have an older, significantly older than average county. Our economic outlook is solid but not vibrant. We're very much blue-collar oriented in the agricultural jobs. So, if you will, the quality of jobs is a little bit less than other organizations, at least in terms of likely impact on health status. So what we found is that we were 41st. Interesting enough, when we looked at the medical care component of the process, we actually ranked pretty darn high. We were actually 15th. Out of the 72 counties in our state for the work Amy does in her clinic and our organization does. And there's another hospital provider in our community that contributes to that. So the disconnect is significant. And one of the things that was challenging for us was to think about, if we're doing the medical care part so well, how come the rest of the population health isn't being affected? And the eye-opener to us is that what we do as hospitals and physicians is only 20% of the equation for population health. That to really move this forward involves engagement of the other 80%. So that's been helpful to us in recognizing how far we have to go on this journey.
And what's top on your list as a priority for goals for your community and population health?
Well, we do have an aging population, as Mark said, and along with that comes a tremendous list of chronic conditions. So we're starting to spend a lot of our time and energy figuring out how to manage those chronic conditions better, how to keep those people out of the hospital, and even taking it to the level of helping to prevent those diseases in the first place. We have a very industrial community. We have a lot of industrial accidents. We have a high rate of asthma and COPD, high rates of smoking and heart disease. And so we're trying to not only provide those people with those illnesses with the best care possible, but to help them figure out how to keep themselves well to help prevent those illnesses in the first place.
In addition to that, where a lot of these diseases manifest themselves in our nursing home population, and to that end, we've actually taken practices like Amy's from internal medicine and family physicians, and actually we've relocated them to nursing home sites where the entire physician's practice is based at that. So they're seeing their regular outpatients over in the nursing home campus. And they give us great space right up at the main entrance for easy access, but that's elevated the level of communication about how to handle these chronic diseases on a more real-time basis so that we don't get admissions coming from nursing homes, and their health status is significantly enhanced as well.
Thank you for joining us today.
Thanks for having us.
Thank you.